Good day, viewers. You're welcome to Let's Discuss program on OSBC TV. Today, we shall be examining issues relating to drug abuse. Drug abuse has become a recognized global problem that faces every country. Different countries across the world are not exempted from the menace of drug abuse, and the percentage of the people involved in this menace are the youth that took the larger percentage. It has been the cause of many debilitating conditions, sometimes leading to psychiatric admissions. So you're welcome on the program. My name is Adibari Jimakide. I'm not alone on the program. I have my co-presenter also, Oluji.
Yes, good evening and thank you for joining us on today's edition of Let's Discuss. And as Adibari rightly put it, drug menace, it's something that has been ravaging the youth around the world. And today we have a guest in the house, someone eminently qualified to discuss this, as she is Dr. Yetunde Ofoha-Godwin, Assistant State Commander Drug Demand Reduction in Osun State, that's NDLEA.
Thank you very much.
You're welcome to the program.
Thank you, Ma. Thank you so much.
Yes.
You're welcome on the program.
Thank you so much, sir.
Drug demand reduction. What does that mean?
Thank you so much. Let me just briefly delve into what NDLEA do. NDLEA is like a coin with two sides. We have the enforcement and we have the reduction. And when we're talking about reduction, as you have asked, we're talking about reducing the menace of drug use or substance use in the community, in the society, and the state, Nigeria, and so. And when it comes to reduction, we're talking about prevention through strategies that we're going to mention when we begin to talk. So that's just what is it. Reduction, prevention, counseling, advocacy, sensitization, campaign, these are involved in reduction.
Let's start from that. How do you reduce that menace of drug and the problem?
When we look at it now globally, there has been a strategic shift from enforcement to reduction. An English adage says prevention is better than cure. And I could remember when I was in secondary school, there is an economic adage that says if there is no demand, there is no supply. Let me just talk about the youth that are involved. We realize that when you catch them young, when you introduce them into what it means, telling them the truth about drugs. Drug use is good to correct ailment, but when we begin to tell them about the negative effect when it is abused, and that is what we're talking about, reduction. You need to let them know, you need to carry the message to grassroots. Surely God is good, drug is good for correction, but when you abuse it, so effect you have it. And because of this, there's going to be a problem for you, for the family, for the society, for the state, and Nigeria as so.
How do you organize that? Is it through seminars or what medium? Now,
let me just shift to National Drug Law Enforcement Agency. The Chairman Chief Executive, the retired Major Brigadier Mara Buba, came up with an advocacy at a strategic time, very timely, and we call it WADA, War Against Drug Abuse. It's not the war you fight with gun, it's not the war you fight with stick or any means. We're talking about carrying out prevention programs and sensitization programs, talking about campaigns to public places, talking about awareness of the menace of drugs. So let me just, because if I want to talk about it, depends on the question you're going to ask later on. We are starting from primary to secondary school to tertiary institutions, going in there because we call it WADA team, War Against Drug Abuse team, that we go out there to sensitize these children and tell them the truth about drug abuse.
All right. Now, before you start sensitizing, children are always very, very inquisitive.
Yes.
They will want to know. Some actually like, playing with fire. You tell them this can get you burned, but they will just want to try it. Now, for someone to abuse drug, what does it mean?
Thank you so much. Let me just create a scenario, and that's how I want you to understand how youths delve into drug or substance abuse. There's what we call risk factors. You can't just see any child coming on one day and saying, I want to smoke, I want to drink, I want to, do anything that is not good. But there are some risk factors. When we're talking about risk factors, we're talking about factors that, prompted these children to go into drugs. We talk about homes that are devastated. We talk about broken homes. We talk about environment that are not conducive. We talk about places that they go to get these drugs without even asking for prescription or not even minding their age. We talk about the emotional feeling, the stress they go through at school, at home. We talk about the mental illness. Sometimes, you can push a child, you push him or her to the wall, and whatever he falls onto is what is going to make up his life. And we talk about peer pressure. So because of these risk factors, when you look at it critically, a child that comes from a home that he or she is not accepted, he or she is not loved, he or she is not listened to, definitely we go out to look for solution. You see a child in the school, she's not feeling happy, he's feeling gloomy, and the teacher doesn't care about it. And suddenly, a child sees another child being happy. He's forced to say, why are you happy? I'm not happy, why are you happy? I say, what is not making you happy? He said, my parents are fond of fighting. Say, forget about it. I'll teach you the way out. The way out is what we call the abuse. They want to abuse drugs now because they have already taught them using the substance, using Igbo, using heroin, cocaine, or prescription drugs are the way out. And so that's why they start abusing it, just to feel cool, to correct the pain, to avoid pain, to avoid the stress.
Okay, thank you for shedding light on that. Okay, how do we detect somebody that is engaging in drug abuse? Can it be detected at the early stage or later?
Of course, because we have stages of substance use.
Okay.
You maybe hear me saying a substance use. Well, it's when somebody is maybe comes to the rehab section, when you are being tested, then they detect out the kind of substance before we can now say drug. Okay. We know the definite drug you're using. So just be used to the word substance use now because we're talking generally. For example, I said that there are stages of substance use or drug abuse. We have experimentation, we have occasional, we have regular, and we have addiction. But one thing that is common and peculiar to these four stages I've said is that we have physical signs. For example, a child that is very quiet suddenly becomes lousy, aggressive.
Okay.
Something is going on. Or a child that was aggressive before, because there are two ways, suddenly become quiet and love staying alone. That's another side effect. Then there are some physical signs like you see the mood, because the use of drug affects the mood. And not only the mood, it affects behaviors. So when you see all these irrational behaviors, whether at school, or at home, a child that likes going to school, now stop going to school without parent knowing, going to another, or a child, we see some signs. That's why when we go to school, we teach them signs, symptoms. Red eye, dilated pupils, we see the tip of the fingers so dark, the lips so dark, and we see some other changes. A child that is very neat now starts, getting dirty, this kind of thing. Or it could be the odor that you perceive when they take the drug. So there's so many things, but it takes you as a professional to understand and to dictate out very early.
All right.
Yes.
A professional.
Yes.
Now, parents now.
Okay.
Because the parents are the first contact a child have with humans. And how can parents detect that this child is probably, not okay,
I want the parents to be, I think they are listening attentively now. And we can't reach out to parents, but the only way to reach out to them, because something you have to know, signs are peculiar, but they are different.
Okay.
It depends on the drugs. The sign could be peculiar, but sometimes, because of what is happening now, because we have some drugs, we have non-conventional drugs that they don't smell. So how can you perceive the odor? But it takes somebody that is skilled to know.
Okay.
So that is why we normally encourage churches have time for NDLEA to come for sensitization, so that we sensitize parents to look how to watch out for signs.
Okay.
We go to schools and we ask them during PTA, please invite the professional to come to teach. But however, let me just say a little bit of it. Like I said earlier, you have a child that is charming, that is lovely, that likes talking. Suddenly, you realize that she likes or he likes locking himself or herself in the room alone. Something is wrong.
Okay.
Or a child that he or she opens up and suddenly he or she closes up. Something is wrong. Or you started seeing him so temperamental, little thing, it will be aggressive. And it wasn't like that. She wasn't like that before. You have to be very careful. And suddenly telling lies to cover up mistakes. They tell lies a lot to cover up the mistake, to cover up whatever you want to know. These are the signs. And most importantly, to physical deterioration. Somebody that was fat before is now getting lean, looking haggard. You understand? So there's no how you will not know. But like I said, the parents that are listening to me now, pastors that are listening to me now, churches that are listening to me now, schools that are listening to me now, there is an urgent need to involve NDLEA in anything they want to do concerning PTA or church. Yes, we have a brief talk. We call it brief intervention, quickly to let you know. And these are what we call one of the prevention, sensitization, and advocacy.
All right.
Yes.
Now, still talking about sensitization. So, at what age do you think, you said the NDLEA has flagged out war against
WADA, yes.
WADA. If you want to start educating children now, at what age can you carry? Because there are some reports that even as low as primary school students are engaged in that, pupils.
A psychologist will tell you that formation starts very early,
Okay.
from 6 months.
Wow.
But a boy that smokes 6 months, we have seen parents that they are smoking, they put it in the mouth of an infancy. The child cannot talk. But a child of 3 years that is able to talk, she's audible, is audible, and he or she is able to express, at the age of 3 years, she is able to express himself or herself. They need it. And that's why WADA starts, advocacy starts from primary school.
Okay.
We go to primary schools. From primary school, for example, I'm going to one of the primary schools on slightly Friday in this town, from primary school to secondary school. But it's better to catch them young from primary schools. Because let me just briefly say something. There was a place we went to about, I think this year or last year, and when the primary section, and suddenly the girl raised up his hand, he says, "Ma, have you seen Igbo before?" I said, "Yes, I saw Igbo." The man that sells beside my mom, one day I went beside his shop and I saw him smoking something that was wrapped. And I thought that is Igbo because it doesn't look like cigarette. It's wrapped. So what do you think about that? 5 years?
All right. I wanted to ask that, do you partner with religious institutions in the fight against drug abuse? Like you said that you partner with schools, and you mentioned of churches and some religious organizations now. From your experiences, What are the outcome of your engagement in those areas?
The most leading church when it comes to WADA advocacy is the Anglican Church, not in Osun State, in Nigeria. I'm still going to talk about another church that one of my colleagues was there. Anglican Church has inaugurated NAWADA. NAWADA is Nigerian Anglican Church Against War Abuse. NAWADA, Nigerian Anglican War Against Drug Abuse. So recently this year we were with the Bishop of Anglican Church, and he was able to gather all the ministers, all the what will I call it, Anglicans, reverends, whatever, maybe Anglicans or not, I can't remember, together for them to be training the trainers, so that when they go to their churches, they'll be able to talk more about this. One of my colleagues was in Baptist, one of the Baptist church, I can't just remember, Royal Baptist or something like that, to carry out an advocacy last weekend. But what we are saying is that most churches, churches are like an ostrich that Ben is head that says all is well. When all, I will say all are not well. Because the only way to target youths, to gather them together, to target parents, to target them together, cannot be anywhere like the church or the mosque. I will talk about the mosque. The mosque also, we carry advocacy to the mosque, drug advocacy to mosque on Fridays. We do. Like this Friday now, I was talking to one of the Muslim, colleagues that whether you like it or not, we're going to have an advocacy. One of the mosque, the big mosque. So we want to talk about drugs. So we are taking letter there, even if it is 5 minutes. It's brief intervention. It works. Because a child that hears that, or anybody that hears it, and at the end of the day, maybe he's sleeping or she's sleeping at home, I had something today. And suddenly, he's about to, I had the effect. Let me reduce it. Thank you so much.
All right, thank you. Still talking about reduction. Now, these drugs come from somewhere.
Oh, yeah.
What is your agency doing to ensure that it doesn't even get to the end users at all?
When we are talking about, you can't prevent
the flow of drugs.
The flow of drugs.
Okay.
Why?
I will let you know. In Osun State Command, we thank God for what God is doing, not only WADA, but when it comes to the enforcement, a few weeks ago, the almost 4 grams of cannabis sativa was destroyed, the farm. You understand?
Okay.
And that's great, that's a lot. But apart from it again, we have a lot of strategic, activities when it comes to enforcement. We have raiding, we have a joint raid, we have most of the notorious areas that our patrol, they are there to stabilize and to monitor. And apart from it again, we have reduction. We work hands in hands together. Remember what I said. Remember what I said. When there is no demand, there is no supply. Whether you like it or not. Okay, when it comes to tobacco has been licensed. Alcohol is licensed. Socially accepted drugs. They are gateway drugs. And these gateway drugs lead to hard drugs. How did they lead to hard drugs? When somebody has been depending on these socially accepted drugs, to meet up with pains or challenges, there'll be a time that the pain he or she has is more than what, or the reward she's receiving from the socially accepted drug like alcohol and and cigarette. He or she would like to go for hard drugs. And that is why we now embark on prevention, on this advocacy, that if you don't demand for it, you cannot sell. For you to say you want to eradicate, no, but NDLEA is trying. We are trying in Osun State, like I've told you. We have a patrol, people that are in charge. We have We go to the joint areas, to check, to look, and we have our surveillance that we carry out. We go to for farm destruction. But whether you like it or not, these people are smart. They are smart. And we thank God the way we are winning the war. You will hear the trains, the way NDLEA is winning the war. But the new chairman now emphasizes on prevention.
Okay.
Which is going to go a long way.
Okay.
If everybody are sensitized, then you don't need to go and buy. I don't need to go and buy. They don't need to sell.
All right, so let me ask this before you come in. Yes, you talked about prevention.
Yes.
Can you mention some of these things? Because most of the time you find out that as a result of peer pressure, you've said that before, some youth might not even be aware of what they are getting into. That their friends can paint it in another name for them.
Yes.
Yes, can you mention some of these drugs and their harmful effects?
Okay, we have types of drugs. We have the socially accepted drugs. We call them gateway drugs. NDLEA, we are not after them.
Okay.
Like coffee, like cola nuts, like cigarette, like gin, like alcohol, like wine, and so on and so forth that are used socially for celebration. We are not after that, but they are dangerously harmful. Cigarettes, alcohol. You know what it causes? The effect. Too much of alcohol causes cancer, lung cancer. Too much of smoking. We have a lot of liver cirrhosis. Too much of alcohol. Smoking to block the lungs. So when we go out, we let them know the effect. My grandfather has been smoking for 10 to 20 years. Okay, yes. There are some that when they give it a trial, well, they are lucky. But we have seen one that starts only once. Just experiment. Just an experiment. And he died. There was a time that, the name of the school I'm not going to mention is in this social state, a medical doctor. She's an orphan. Because of the pain she's going through, that the parents are not, she tried tramadol. 300 milligrams. She died in her sleep. Experimentation, only once. We have other ones like hard drugs, like cocaine, like heroin, like cannabis. And they train the most. We have psychotropic substances, we call them prescription drugs, like stimulant, like depressants. Like diazepam. You understand? We have some that, though they are medically good, cocaine, heroin, we use them to stabilize, especially heroin people that want to go through medical operation, something like that. And it's controlled. But what we're saying is that the most trending one now is non-conventional drugs. And when we mention these non-conventional drugs, these are drugs that people, they package it themselves through some chemical processes, not tested, and they are using.
Okay. Sometimes
I'm very, very careful to mention them, but what we have realized is that even the children of nowadays, because of the technology, they know more than you do. Imagine somebody sniffing correction fluid to be high, rubber solution, dye, ewokego excreta, gutter water, pawpaw leaf, and even most of the leaves we use for medical reasons, they abuse them. I've forgotten this name of this tiny, I've forgotten.
Leaves or herbs, okay.
Very good, they abuse them. What about prescription drugs like tramadol, ephedrine, diazepam? They do. Cough syrup, taking about 5 bottles of cough syrup because they want to be high. They just want to be high. They want to be cool. So we have a lot of them, but the most strange one now is non-conventional drugs. You can't perceive the odor. They are available. They are in your house. They are everywhere. That's the problem we are now facing. Not even cocaine, heroin now. We have the conventional drugs. Those ones.
Yes, the ones you call non-conventional.
Yes.
They do not have names, do they?
That's what I'm mentioning.
Just
since we have pawpaw leaf, we have moringa leaf, we have gutter, rubber solution. They are non-conventional because they are not tested.
Okay.
They didn't go through chemical process, but there's a way they do it. What about the other ones now with what's the name of this again? Sisha. What about cloud?
And you don't go after all this one.
We do. That's why we're telling you that is what is trending now. Because you can't perceive the odor. When somebody smoke cannabis, you can perceive, you will know. But we're telling you that when these things are used, you can't perceive them.
So how do you get those that are doing it?
So it's difficult.
Because there's what we call drug kit test. You test them.
Okay.
You know.
All right.
Because we're experts.
Okay.
There's somebody in my office now that was sent from one of the university to come for test and the rehabilitation.
All right. Let's come back to the issue of rehabilitations. I still want to dwell on this influence of this drug abuse. Especially, it is possible that some parents might influence their wards or children negatively.
Yes.
Either deliberately or for example, if you have a parent who's taking antidepressant tablets at home, the child, it's possible for the child to be influenced to just say, my mom always take this thing for the because of pain or whatever. Let me see it. My father is taking cigarette. What is the joy there? You might want to attend it. What's your advice to parents in order to checkmate the menace of drug abuse?
You know, I was laughing when you were talking. There's something happened when my daughter was very small, was in the secondary school. The way she's tall, so she was going for basketball playing. And when she got to school, I, as a professional that worked in NDLEA, have never educated her about some drugs that sportsmen and women they use. It was oversight. It was an oversight. Truly, I was just hearing, and Mama was telling my grandma, this girl has been sleeping from morning up. She has not woken up. I said, what happened? I said, I don't know. So when I got back, she now told me that, oh, Mommy, what happened was that one of her friends, her father is a sportman. She came and she gave us tramadol, 100 grams, 100 milligrams, 200 milligrams. But I just took 50. I said, you were very lucky. He said, Mom, I started feeling, and when they were hitting us, we were not feeling the pain. So actually, ignorance. Most parents are very careless. That man didn't teach her during that birth. She was watching her father, and she felt that was the right thing to do. So you wouldn't blame. So I was the one that I went back to school, and I was able to educate the school, and after that we were able to know that she has been packing a lot of tramadol to school anytime they are going to play.
Wow. And
the father didn't know. So maybe the father was just using it for pain. And let me just quickly round up again. There is something we call listen first. It's one of the United Nations 2 words tested. They are scientific words. They were tested on some group of children that parents listen to, and children that parents do not listen to. They found that the children that listen to, they were able to avoid the use of drugs. What do I mean by listen first? Listen first. A child is so traumatized, and he or she comes back home and says, Mom, Dad, I was beaten, I was bullied. You understand? You listen. And irrespective of what you are doing, you listen and you're able to give attention and say, okay, I'll follow you to school. But what about those ones they were not listening to? That they thought, come on, get away. I'm tired. They tend to go out and they are influenced by their peer group. And they now begin to use drugs. Sometimes homes too is very, very important. When you come from a home that is holy-bolly, father and mother fighting all together, they tend to be destabilized. And when they go to school, they look for a way out. And the only way out is through drugs. That is why I say most of these risk factors, they are the cause of drug abuse. The children are innocent. And technology too has done a lot of damages. You can be on the phone and Google where to get drugs, and they will come and deliver at your doorstep. And that is why you have to be mindful of the kind of phone you give to your child. Even if I thought she's going to work on phone for assignments, let it be your phone he or she will use. You can buy a small phone to go to school to monitor. but not big phones that involves internet that will make them to be open up to dangerous sites.
All right, thank you very much, Dr. Yetunde Ofoha-Godwin.
Thank you very much.
We have been discussing the menace of drug abuse, and Dr. Yetunde Ofoha-Godwin is the Assistant State Commander, Drug Demand Reduction, Osun NDLEA. Yes, let's look at the general effect of drug abuse now. What are its effects on society?
The first thing I'm going to talk about briefly, when a family is affected, the society is affected. What makes the society? The family. When you have a destabilized family through substance use, you have a destabilized society. We're talking about raping. Most of them, the rapists at school or anywhere, they're under the influence. I went for a program about 2 weeks ago, and for cervical cancer program, and one of the organizers told me that they are referring a group of girls to me. This girl was a virgin. She's staying with, here in Mishogo, she's an orphan. She's staying with her mother, with her grandma. And in the school, they arranged, because she's beautiful. When she was coming from school, a group of boys kidnapped her, they raped her. And when they were tested, they were under the influence of cannabis, Igbo. They have smoked heavily. So that's one of the effects of it. When you talk about cultism, it's an effect. You see somebody plugging iron and using it to insert into the vagina of a lady. Is it normal? No, he is under the influence of drug. We talk about kidnapping. They are under the influence. You see what is happening? Everywhere. Influence of drug. And we see mental illness. Most of these mental retarded people on the streets is because you see them in the money. They are okay. See them later in the evening because they have collected 1 or 2. They will use it to buy the drug. They use it. They start behaving. So a lot of things has really gone wrong in the society, and that is why the government has to pay attention on prevention to the grassroots. If the governor is hearing me, the governor has to pay attention to prevention. If the commissioner or anybody or the permanent secretary are hearing me, pay attention to prevention. If a church leader is hearing me, if parents are hearing me, pay attention to prevention, because prevention is better than cure. Even when they are treated, they relapse.
Okay, let me ask this. Is there any correlation between drug abuse or addiction? How will you expatiate? Is there any difference?
It's a stage. Because of time, I spoke about stages of substance use.
Yes.
The first one is experimentation.
Exactly.
When you experiment and it goes along with your system, you continue. If it doesn't go along with your system, you stop. You understand? It makes you tipsy, it makes you going crazy. You hear sounds that listen, you stop. From there we go into our occasional use. Like anytime you feel the pain, you want to feel high, you go. From occasional use, we go to what we call regular. Now, regular, I feel okay with it. It's gone along. But when it comes to addiction, addiction is when you are hooked permanently. Your life, your work, your studies, your thoughts, your goal, your dream, everything that involves around you now centers on addiction to the drug. And that's the last stage.
So what are the dangers of that?
So when we're talking about dangers of addiction, it's what I said. The society is full of atrocities now. And majorly these atrocities are on, or they are connected to addiction of drugs. These people we're talking about, Boko Haram, you think now many of them, they are on drugs. They are addicted. That is, we see 10 people raping a girl. Is it normal? You have feelings. There's blood that flows in you. But because you are addicted now, their feeling is already there. Remember when I was talking about substance, I said it affects the behavior, the mood, and the mental state of that person. So addiction is like that. Yeah, totally hooked.
Oh, okay.
And you need treatment.
Okay.
Addiction cannot be cured without treatment. The other ones can be managed. The addiction, you need rehabilitation.
Okay.
That you have just spoken my mind. What kind of rehabilitation strategy do you offer?
Normally, NDLEA offer rehabilitation, but presently in Osun State Command, we offer outpatient rehabilitation because that's one of the projects we want the governor to delve into. We need a rehabilitation. Most of the governors in other states, they provide rehab. Normally, this rehab belongs to you, belongs to the state. It doesn't belong to NDLEA. People will benefit from it. When it comes to rehabilitation, treatment comes in because treatment works.
Okay.
There are a lot of treatments they have to go through, medical treatment, psychological treatments, and skills are going to be acquired to overcome. There's medical treatments in rehabilitation because treatment works. There's psychological treatments, which is not using of drugs, that we're going to put you through skills to know that you can still walk out even though you have been harmed. You can still be who God made you to be, because we're going to work on the CBT, the cognitive behavioral therapy is what we normally use. We need to work on the cognitive behavior that made them to feel that what they are doing is the best. And we need to change what is bad to what is good through skills.
To make them fit back to the society.
Yes, how to say no.
So how long does that take?
Well, it depends on the years of addiction.
Okay.
And it depends on how dangerous the person is. But rehabilitation starts from 3 months, 6 months, 1 year, 2 years, 3 years.
3 years.
After spending 3 years, they will still go back again, they will come back. They will relapse. They will start again. We start from the apex actualization.
Okay.
We start again.
I'm just imagining someone being in a rehabilitation center for 3 years.
There are a lot of skills.
Okay.
There are a lot of skills. You don't just sleep and wake up
right,
there.
tell us.
There are a lot of activities. You wake up in the morning, you have your prayer, if you're Muslim, and Christian, you do it. You go for jogging, you go for exercise, you come back to the classroom. We have a group therapy, we have a single therapy, where a lot of things that have been affected, we now put in new thoughts. Because really, addiction is like, I want to say it's like habits,
Okay.
a chronic habit. And you need to change that habit to good habits. So we begin to teach them those good habits that drugs have altered. So that is it. So it's so funny that even after spending 3 years, even relapse is part of treatment, because you have to let them go to know whether they are really true. You see them going back again.
Wow.
They come back again to start all over. It might not be 3 years, but you start again. Until they finally, we don't say cure. You can't cure anybody, but you can make it to reduce. That is why when many of them get married, I will tell their wife, so anything could happen, you know. He was using smoking cannabis. Maybe he's smoking cigarette now. It's part of reduction. See, slowly. If it were to be in abroad, we will have what we call harm reduction. That somebody taking cocaine, you now replace it with another form of drug to reduce, because utterly they can't get out of it. It has become part of them. Yes.
And so who
We don't practice that in Nigeria.
Okay,
We don't.
Okay.
No. We just want to start, and we have not started.
So my question actually is, who is responsible for the cost of treatment?
Their parents.
Or the rehab center.
Their parents.
Oh.
Or if the governor decided to fund, it's good.
All right.
If he decides to fund, or many of them that have decided to be funding it, there are people who are enjoying the place. Because in the rehab is a setup of medical personnel, the doctors, the pharmacists, the counselors, the clinical psychologists, pastor, imam. It's a set of people. Nurses are there. So that is it.
The NDLEA is a federal government agency.
Yes.
So why is the federal government not funding it?
That is where now we are carrying this advocacy out. They are hearing us now.
Okay.
They are hearing us now. Osun State Command does not have rehab because the place we're given is even small. Yeah. We're sharing an office with other people.
Okay.
But there is a place they can build. If the governor or anybody now wants to talk on behalf of NDLEA, there is a space in the compound we can build a rehab. A decent one to start with.
Can individual intervene? Or philanthropist?
They are welcome, sir.
Okay.
And their names, each of the rooms will bear their names. So all. So room. To let people know that we have good people among us.
How can people get registered for rehab services? How do they approach?
Like we say now, we only operate outpatient because we don't have facilities. Okay. You come in the morning, you go in the evening.
Okay.
You come in the morning, you go in. But outpatient is not that as effective because somebody that is going back again might pass through the same route that he's buying or she's buying. Because you can't expect me to follow. Unless, why it is effective, they come to pick, drop and pick. But what about people that are less privileged? That they don't have such opportunity?
Okay, now you're still talking about rehabilitation now. You said there are those that spend about 3 years and once they leave, some will still go back to. What about the possibility of changing the environment?
You know, everything now bounces on the parents. That's why I said when it comes to rehabilitation, it involves big money. Most of the private rehab is 450,000 per month.
Wow.
The cheapest you can get is 250,000 per month. Their drugs are expensive. You involve therapists to come. So how do you manage that? So that is why I believe that everything bounces on the parents. That is why we keep on telling them when we go out for advocacy, please, it's expensive. Your parents, they have tried, especially in the tertiary institution, in private, to spend so much on you. Don't waste it because rehab is expensive. And that is why the parents, once they get into that last stage addiction, they have lost hope on that child. You have chosen your own. Be going. Where will I get 450? Where will I get 350 per month? Where will I get 250 per month? In private rehabs? Where? Even if you come to NDLEA, won't you be treated? We go to buy your drugs. I can't buy your drugs for you. It's not possible. You see, many of them, they are HIV victims. Many of them, they are diabetics, victims. Many of them, they have one ailment or the other, joined with the illness, the mental illness. So, what am I going to do? You need to be treated and you need to pay.
So, from the look of things, anybody who is not buoyant enough, will never get rehabilitated in Nigeria.
You can get. I'm not saying you can get.
No, you said it's very expensive.
It's expensive. You get the little you can get. If you come to me
and
you said you don't want treatment, I'll give you the psychotherapy treatment.
Okay.
You can't bring a child to me and there's a medical bill of 100,000. Am I paying from my salary? Did NDLEA say I should pay from my salary? Already, that is why we say prevention is better than what? Than cure. That's where I'm coming. Because to cure is expensive. What we are saying is that we don't push them away. Even if you don't have money for treatment facility, the psychotherapy facility is free. That is changing their thoughts. We have seen so many children like that. They didn't go for treatment. But let me tell you, treatment is important. You have to flush those things out. You have to treat them. What about somebody with HIV victim? Are you not going to treat? What if somebody with any other ailment? Are you not going to treat? You have to. Some of them came with wounds, deep wounds, through street fights. Are you not going to win because of bacteria? Can I use my salary? Of course, I do help. but have limits. I know many that have helped financially, but I have my limits because I have my own budget. But psychotherapy is free.
All right. Thank you very much. Does anybody under the influence of drugs that committed a crime, is such person punishable under the law of the country?
It's not, except it goes with crime.
It goes with crime?
Crime. Maybe as an addict you raped.
Okay.
Or you killed.
Okay.
You were caught. You know, you are not above the law. If you kill, those people that kill, you think they just kill like that? They were were they not sentenced? It's punishable. It's punishable. Or you stabbed. It's punishable. For example, these boys that they raped that girl, she has not recovered from me. They raped her from morning till evening.
Wow.
She cannot walk well. Fortunately for them, they were 21, 22, 18. Is it not punishable?
It is.
The age. It is. Because when it comes to that, it's not even NDLEA that will hand you over, it's the parent of the victim. They take you to court. It is now left for the court to decide. So, for you smoking, drinking, is not punishable. NDLEA, we are not after you smoking or using socially accepted drugs. But when you now drink as a driver and you kill 18 passengers and you escape, you face the wrath of the Federal Road Safety. That is it. Or you drank and you suddenly cause a problem on the street. If you are picked, you are going to be reminded, Abby. So that is it.
Right.
But when it goes along with crime, that is it.
Okay, you have said a lot about the roles of parents.
Yes.
Now, this youth, the students, the pupils, also spend a larger part of their time in schools. Now, what should teachers look out for?
When we go to schools, we do, let me train them. I want to use the right word. We train them.
The teachers?
Yes, if the schools are ready to train the counselor and the teachers.
Okay.
Because teachers are to be involved in counseling. You are in the class, you see a child sleeping. As a teacher, you need to know that something is wrong. Or you see a child not concentrating, being bullied at school. That is a problem. Yes, they spend a lot of time in school, but if the foundation is not good, the teachers, they will suffer it. And the foundation are the parents. A child that comes from a home where husband and wife beat up other, when he or she goes to school, the only defensive mechanism he or she has is beating other people for his right, for a right. That is it. A child that you don't listen to. You see, yesterday I was so tired. My child was just calling me and I have to listen. Parents, listen first to your children. When you come back from work and you are tired, they knock at your door. Open the door, let them open. Let them sit beside you, then let them pour it out. Maybe he or she is bullied in the school. When you are eating and your child comes to you and say, Mom, stop that food. Listen first. When you are about to rush out to your place of work and the child, excuse me, sir, listen first. He wants to communicate, she wants to communicate. An inability not to open up at the right time, it causes depression or emotional problem. Instability, which the wrong person outside there will listen to her or him and teach him or her the wrong thing. So when we're talking about the parents, teachers, we talk about the foundation for the parents. They have a lot of work to do. The teachers, they have to follow up what has been started at home. And that is why we have it. PTA. Oh, but Bumi is always sleeping. Principal, we need to call the attention of the parent. That's why they come in. Oh, he's a bully. We need to call the attention of the parent. That's how the teacher calls. Or a child that maybe he or she was not giving food. The teacher needs to tell the principal to provide something little so that they come in. But they follow up the work that I started at 2.
All right. The larger percentage of those people that are involved in the drug abuse are the youths.
Yeah.
Your final advice to Nigerian youths?
Well, I need to let them know that whether you like it or not, youths, you are the leaders of tomorrow. You are the next president, the vice president, you are going to be the medical doctor, the pastor, the bishop, the imam of tomorrow. And you have a goal, you have a dream. I wouldn't want you to allow any situation to kill your dream to be whatever you want to be in the future. And peradventure, you get yourself in the risk factor. Listen to me. You have your life to live. You don't live the life of your parents. You don't live the life of a friend. You have your own personal life to live so that you can become important in life. Finally, I need to let you know the way you lay your bed is the way you are going to sleep on it. Avoid bad friends. Follow good friends. And listen to your parents. Open up to them. Open up to your teachers. Open up to people that have knowledge and experience in life to give you the best. Thank you.
Thank you so much. Dr. Yetunde Ofoha-Godwin. Thank you. You have spoken beautifully well, and I hope you are listening. It is the way you lay your bed, you lie on it. There always reward, consequences for every action. Thank you once again for making it to the program.
Thank you.
Thank you, sir.
Yes, and
it has been very revealing and educating, and this is the parting point of the program.
Yes, this is where we'll be saying our bye.
The executive producer is Akola Olabi. Bye.